Now we're trying to look at standard precautions in radiography. So standard precautions is more of like the rules and the regulation that have been set down, you know, to help the patient stay safe and also help you as a radiographer stay safe, you know. So they are the standard precautions, and you know the funniest thing is it's a must for you to protect yourself. In a working country, if they see you breaking any of these rules, you could actually be sanctioned for some time, you know. So for radiography, the rules we have on ground is basically the rules are there to actually what prevent infection spread, you know, and they are always there to actually what protect the radiographer. But first of all, they are there to actually protect the patient. You understand? So the first rule here is what hand hygiene. So you have to be performing hand washing or alcohol-based rubs before you touch a patient and after you touch a patient, and also after handling an equipment, after touching a surface, after touching imaging receptors, a lot of things. So use of personal protective equipment. So you are wearing that clothes on your body so that if there's splash of blood, splash of body fluids, you know, maybe your body just touching some contaminated equipment, you don't have a spread of the infection. You also use nose masks, you know, to actually avoid all those, you know, airborne transmission of infections. Then eye protection, you basically use all those eyeglasses, you know, to stop the spread. So respiration and hygiene and cough etiquette is this. You encourage patients to cover mouth and nose when coughing or sneezing. Provide tissues and masks in waiting and imaging areas. Maintain spatial separation in waiting rooms. Okay, so when patients are seated on the table, or sorry, on a chair waiting for them to be attended to, there shouldn't be, you know, no gum body. All right. So safe handling of equipment, you have to always disinfect the different equipment in the radiography lab. Then you can use some equipments that you can just use them once and dispose, and make sure you dispose them properly. So the whole surrounding should always be clean. Okay, so you use disinfectants and the rest of it. And when you want to inject patients, okay, contrast and all of that, just make sure that what the whole procedure is what aseptic, you know. So patient care practices is you always help your patient, right? If they are helpless, so to say, too weak, or they are too old, or they are children, you have to come in and also help them to obey the laid down rules.